Corynebacterium diphtheriae. This is an organism that is a causative agent of diphtheria, which is a childhood disease or a pediatric disease. Now let us know about the important characteristic features of this Corynebacterium diphtheriae. These are the organisms which are gram-positive in nature. They are non-acid fast, non-motile, and irregularly stained with the presence of a characteristic granules which helps them to identify in the laboratory, and they show a characteristic club shaped swelling, because of which these organisms are usually called as Corynebacterium diphtheriae. And diphtheria is usually given the name because of the tough leathery membrane or the leather membrane they usually cause inside the mouth during this particular disease. And the most important genus that is a causative agent of the diphtheria is the Corynebacterium diphtheriae. This organism or the disease has been known since earlier time. That is, the history shows that the presence of the organism and the causative agent that is involved in the causation of the diphtheria. RTS was the first who has identified this organism in the Egyptian or the Syrian ulcers, and today we call them as the diphtheria, or medically they have been identified as diphtheria. It was Bretonite who had identified the disease and given the name as diphtheriaid, because it is the one that is able to cause tough leathery pseudomembrane inside the mouth, and hence the name diphtheria was given. And the organism is a Corynebacterium because they form a club-shaped swelling in the smears. And this was first observed and described by Klebs, the scientist, but it was cultivated by Loeffler, and hence this organism is given the name as Klebs-Loeffler bacillus. And it was Loeffler who was able to induce this infection in the experimental animals, and he found it to be associated with the diphtheria. But he showed that it is not the organism that is causing the disease, but it is certain exudates that are released by the organism that is involved in its pathogenic effect. So it was Rox and Ersen who was able to identify this exudate as the exotoxin that is released by the bacteria, and it is the one that is mostly involved in the pathogenic effect of this particular disease. Now, since this is an antigenic character of the organism, that is the exotoxin, towards this exotoxin the body produces the neutralizing antitoxins. So the presence of antitoxins towards this exotoxin was demonstrated by ML1 bearing, which helps us to bring about an immunization towards this particular disease. Coming to the morphology of these organisms are slender rods with a characteristic club-shaped swelling at one end or both the end, and frequently they show this type of swelling in the media, and they measure about 0.3 to 6 micrometer in length and 0.6 to 0.8 in diameter. They are highly pleomorphic in nature, that is, they keep on changing their shapes and are non-smoring, and sometimes this organism shows septa, and infrequently we can also see the branching in this particular organism. They are non-acid fast and they are non-motile rods, and the main characteristic feature of this organism is they express granules which are called as polymetaphosphate granules, and this polymetaphosphate granules helps to identify Corynebacterium diphtheria in the lab. So it is a characteristic feature of this organism that helps us to identify it in the lab. And these organisms are highly the one that are able to take up the aniline dyes and show a gram-positive characters. Apart from that, this can also be stained with the help of Loeffler's methylene blue. The Loeffler's methylene blue solution or the stain is usually taken up by the granules, and they appear as bluish purple color, and hence these granules are called as metachromatic granules. Otherwise, these granules are also called as volatile or Babes-Ernst granules, and they are usually present at one end of the organism, and hence they are referred to as polar bodies. These granules can also be stained with the help of Neisser stain, Albert stain, or Ponder stains. These stains are specially used to stain the granules and hence to identify the organism in the lab. And coming to the arrangement of this organism, they show characteristic arrangements. They are in pairs, show palisade type of arrangement, sometimes appearing as V or L-shaped structures. So these V or L-shaped structures, because they appear Chinese letters, it is also called as cuneiform arrangement. And this Chinese arrangement is usually seen in this organism because of the incomplete separation of the daughter cells after the binary fissions. Coming to the cultural characteristics of these organisms, where these organisms are scanty in the ordinary media, and hence so we have to enrich the media in order to isolate this organism in the lab. So they have to be enriched either with the blood, serum or the egg. The optimum temperature at which the organism usually or satisfactorily grows is around 37 degrees centigrade, and the temperature can vary from 15 to 40 degrees centigrade. Coming to the pH of the organism, optimum pH in which they usually grow is around 7.2, and these are aerobes and facultative anaerobes, and the usual media on which we can grow this organism is a low-fluorescence serum slope or telluride blood agar. In the low-fluorescence serum slope, you can see the organism immediately growing within 6 to 8 hours, and the characteristic colonies that we can see or the appearance of the organism on the media is they look like small, they are circular white opaque colonies which can be enlarged on further incubation. And coming to the other media, that is a telluride blood agar. It is a selective media that helps to identify the organisms in the lab by growing them selectively, because telluride is a component which at 0.04% can inhibit the other group of organism and allow only the Corynebacterium to grow. So they have been modified. Telluride blood agar had been modified by different scientists to isolate the organism in the lab. So these are called as Macleod's media or Hoyle's media. Macleod have identified the organism on the telluride and has classified the organism based upon its pathogenic characteristic. The organism have the ability to convert the telluride to a metallic tellurium, which gets incorporated onto the organism, giving them grey or black color. So the presence of grey or black color colonies on a telluride media helps us to identify it as Corynebacterium diphtheria. Now coming to the pathogenic effect of this organism, the Macleod has classified organism based upon its virulence into 3 types: gravis, intermedius and mitis. The gravis being most fatal one, that is involved in epidemics and causing diseases worldwide, whereas the mitis is the less lethal one or the mildest variety, which usually causes less infections when compared to the gravis. Now coming to the intermedius, it has a characteristics of both the gravis as well as the mitis colonies. And the presence of the organism, that is the virulence of the organism, is not the strain that is usually causing the disease, but we have to know whether it is a toxigenic strain or not. Irrespective of the strain that is usually involved in the disease causation, we should know whether the organism is toxigenic or not, because it is the toxin that is usually pathogenic in nature. Irrespective of the strain, the toxin produced by this organism is very important for us to know how it is involved in its pathogenic effect. Now coming to the biological characteristics of this organism that are causing the diseases worldwide. So coming to gravis and intermedius, they are the one mostly involved in the fatal diseases of diphtheria, mitis being less lethal, and because of the formation of pseudomembrane, that is a characteristic tough leather that is formed inside the mouth because of the bacterial diseases. Next is the paralytic complications are common in gravis, and hemorrhagic complications in intermedius, whereas the obstructive lesions in the airway passages are usually caused by the mitis species. Next is most of the mitis species are the commensals of the human. Though they are virulent, sometimes these organisms can establish themselves as a normal flora inside the mouth and can cause the infection during the opportunity when they are given to cause the infection. That is when the immune system of the host usually comes down, this organism can cause the infection in the individuals. And coming to the distribution of this organism, how they usually cause the epidemics and endemics, it is the gravis and intermedius mostly involved in the epidemic, whereas the mitis is the one that is involved in the endemic diseases. And there is a wide variation in the frequency of the occurrence of these organisms. That is depending upon the different types, different people, this organism usually causes the infection. And there is evidence to show that gravis and intermediates have the ability to cause the infection even in the person who has a natural immunity towards this particular disease, and also in the immunized individual, whereas mitis is the one that can be easily brought down after immunization. Coming to the cultural characteristics, that is how they are usually grown in the organism and how can we identify them with the help of the biochemical characteristics. These are the organisms that can ferment glucose, galactose, maltose and dextrose, but not lactose, mannitol and sucrose. But some strains which are virulent in nature are also found to be fermenting sucroses. And the fermentation ability can be best seen in a serum which is called as a his serum water, which helps us to easily identify the organism in the lab. And the proteolytic activity is absent. They do not hydrolyze urease to form the phosphatase. Coming to the toxin, which is the most important characteristic feature of this organism. So the organism can cause diseases in two ways. One is called as the infection, the other one is called as the toxinogenic strains that are able to cause infection by producing the toxin, that is called as intoxication. So the presence of the organism sometimes like when the organism is dividing, they can cause the damage to the host cells. So these are called as infectious disease. But if the organism while multiplying has the ability to produce certain substances that causes the pathogenic effect, they are called as the toxins. So this organism has the ability to produce an extensive potent toxin which is called as the exotoxin, and most of the strains are involved in the production of this toxin. So it is said that gravis and intermediates are highly toxinogenic in nature, whereas the mites is less toxinogenic, and 90 to 95% of the gravis and intermediates has the ability to produce the toxin, whereas 80% of the mites have been reported to producing this toxin. And all the virulent strains have the ability to produce this toxin. So they can be identified in the lesions that are produced during the particular disease, and the toxin is related to the pathogenic effect in the host. And the avirulent strains are mostly or commonly seen in the contacts or the carriers, and the one usually carries this particular disease in the convalescence patients, etc., and mostly involved in the extrafascial infections. Now coming to the toxin production, the production of the toxin varies from one species to the other. Some species can produce abundant amount of toxin, whereas some produces in lower amount. And the toxin that is mostly, and the strain that is mostly used to produce a toxin in the laboratory is a Parkes William 8 strain belonging to the gravis and the mites species. Coming to the diphtheria toxins, as I told you, this is highly potent in nature, and a small amount of the small unit of toxin can kill nearly millions of the experimental animals. This has been crystallized and the molecular weight has been demonstrated. It is having a molecular weight of about 62,000, and it is extensively potent toxin having two fragments. So the A fragment having a molecular weight of about 24,000 and the B fragment with 38,000, and both the units are very important to show the toxinogenic effect. And this toxin is usually secreted in inactive form and gets activated only when there is a proteolytic cleavage with the help of proteases. So proteolytic cleavage with the help of proteases can break the mask that is hiding the A subunit. So A subunit and B subunit are together joined with the help of disulfide linkages, and both the units are very important to show the characteristic or the pathogenic effect. So when there is a proteolytic cleavage, the mask that is hiding the A unit will be removed, and the A unit will not be active to carry on its pathogenic effect. So the B subunit is given the name as binding subunit, whereas the A subunit is the one that is active in nature, because it is the one that usually enters into the cell and is able to bring about the pathogenic characteristics. And this toxin is highly labile in nature, and with the help of this toxin we can prepare the toxides. Toxides are nothing but they are the substances which are antigenically they are inactive, but immunologically they are active. So we can convert the toxin to toxide, and these toxides are mostly used for the immunization purpose. And this toxin can be easily converted to toxide at when the strains are grown at a temperature of around 37 degrees centigrade with the formalin of 0.2 to 0.4%, and they are grown for 4 to 6 weeks on a culture. Now converting the organism to a non-toxinogenic organism, or the toxin that can be converted to the toxide. Now this toxide can be used for the vaccination purpose. Now, coming to the toxinogenic strains, it is not the bacteria that is usually toxinogenic in nature, but the bacteria which has been lysogenized with the phage, which is called as a Coryneyphage. So, this lysogenized virus DNA usually carries the gene that is mostly infective in nature, or the ability to produce the toxin. As we know, viruses have two types of life cycle when they enter into the host. Bacteriophages are the viruses that enters into or that attacks the bacteria. Now, when the viral DNA enters into the host cell, that is a bacterial cell, it can bring about two cycles. One is a lytic cycle, where they completely take over the bacterial cell and kill the bacterial cell. That is, it causes the lysis of the bacteria. So that is called as a lytic cycle. Now, coming to the lysogenic cycle, the viral DNA gets incorporated into the host chromosome, and it survives in the host in a commensal or mutualistic relationship. It divides as and when the bacteria divides. But there comes a time when the lysogenized viral DNA have to be excluded, bringing about the lytic cycle. So similarly, most of the bacteria can be lysogenized, and it is in the diphtheria bacteria that the virus nucleic acid, which is belonging to the Coryneyphage, gets integrated, and it is called as a lysogenized bacteria. And this viral DNA usually contains the TOX plus gene. So if the viral DNA contains the TOX plus gene, the organism becomes toxinogenic in nature because it is able to produce the toxin. And non-toxinogenic strains usually do not have this type of viral DNA that gets integrated into them. But we can convert the non-toxinogenic phages or the strains to the toxinogenic by inducing them with the beta phages. So this particular phenomena is called as the lysogenic or the phase conversion. And the production of the toxin also depends upon the media in which the strains are usually growing. So they require an iron concentration of 0.1 mg for the production of the toxin, whereas 0.5 mg can inhibit the production of the toxin. So once the toxin is produced, it can bring about the pathogenic effect in the different cells. And this organism, when it infects the host, the toxin is able to cause the pathogenic effect by inhibiting the protein synthesis in the cells of the host. And the step where this toxin usually acts is during the translation process. As we know, protein synthesis has two important steps. One is the transcription, the other one is the translation. So in the transcription process, there is a transcription from the DNA to mRNA, which carries the messages of the polynucleotide chain. Now this polynucleotide chain information can be translated into the proteins by a process which is called as translation. So the toxin has the ability to inhibit the translation process. So they can inhibit the polypeptide chain in the presence of NAD, that is nicotinamide adenine diphosphate, and specifically they inhibit the elongation factor 2 that is involved in the elongation of the polypeptide chain, and hence there is no proper protein synthesis that can take place in the cells. And the cells that are usually affected by these toxins are myocardium cells of the host, adrenal cells, and the nerve endings, thereby inhibiting the protein synthesis and causing damage to the host cells. So the pathogenic effect is not because of the bacteria, but because of the toxin that is produced by the organism. Now coming to the resistance of this organism, these organisms are heat resistant. They can survive very well up to 40 degrees centigrade, but increasing the temperature might kill this organism. At 57 degrees centigrade, they can be killed at 10 minutes, and at 100 degrees centigrade, you can kill them within a minute. And these organisms are resistant to light and other desiccation factors and the freezing temperatures, and the organism can be cultured from the bits of pseudo membranes after 14 weeks, and they can survive in virulent nature in the blankets and the floor dust for 5 weeks, and they are highly susceptible to different types of beta-lactam antibiotics and broad spectrum antibiotics. Coming to the antigenic structure of this organism, the antigenic structure is heterogeneous in nature, and with the help of agglutination, you can classify the different strains of this organism into different types. Graves have been classified by agglutination into 13 types, intermediates into 4 types, and the mites into 40 types. The other type of classification is mostly the bacteriophage typing, and 15 bacteriophage types have been identified, where type 1 and type 3 strains are the one that belongs to mites, and type 4 and 6 are the one which belongs to intermediates, and type 7 is the avirulent gravis. Remaining all are the virulent gravis types that are involved in the pathogenic characteristics of this particular disease. And bacteriophage typing is the most stable one when compared to the other type of classification. Apart from bacteriophage typing, you can also classify the organism or type the organism based upon the bacteriocin present in the organism, that is called as a bacteriocin typing, or a bacterial polypeptide analysis, which is more sophisticated one to type the organism, and DNA restriction patterns or hybridization with the DNA probe. So all these are nothing but that involves the DNA and molecular typings. They are called as the molecular typings. Now coming to the pathogenic effect of this organism, that is the pathogenicity, which is another important characteristic feature of this organism. And the organism has an incubation period of around 3 to 4 days, or sometimes it can be also a day, single day, where the person is immunocompromised or having a weak immune system. And in carriers, the incubation period can be for a longer period of time, and the site of infections where they can be spread are usually the facials, laryngeal, nasal, otitic, conjunctival, genital, and they can also include or cause infection in the cutaneous. But the cutaneous infection are said to be secondary infection, which can be established on a pre-existing infection, and they are able to cause white low ulcers in the patients, and mostly cutaneous infections are caused by non-toxinogenic strains. And coming to the clinical severity, the first we'll be discussing about the facial infections, which is the most commonest type, varying from catarrhal infections or the inflammation that is involving the mucous membrane, or it can widely spread at the different areas involving the facial characteristics. And depending upon the clinical severity, you can classify the infection into a malignant, septic, or hemorrhagic. The first step, or the most severe one, is a malignant, also called as a hypertoxic, which includes the toxemia, where the toxins are produced at a higher level and cause the pathogenic effect, with a marked adenitis, which is called as a bull neck, which is the characteristic feature of this particular disease. The bull neck is usually formed due to the pseudomembrane that is formed during the growth of the organism and the release of the toxin, and the death usually occurs due to the respiratory failure. And if the person recovers from this disease, he is more prone to paralytic sequel, which is usually followed after this infection. Next is a septic, which can lead to ulceration, cellulitis, or gangrene on the pseudomembrane, which can further carry it out to the hemorrhagic one, where you can see the bleeding from the pseudomembrane, that is a bleeding around the pseudomembrane, also involving the epistaxis, that is the nosebleed, or conjunctival hemorrhage, or purpura, which is involving the skin, and the skin bleeding, or also can lead to generalized bleeding tendency. Coming to the common complication associated with this character or the biological characteristics of this disease, that is the malignant, septic, or hemorrhagic, the common complication associated with them is the asphyxia, that is a respiratory failure, where there is a blockage of the respiration due to the formation of the pseudomembrane, that is a tough leathery pseudomembrane that is formed during this particular infection, and this will prevent the respiration to carry out in a normal way, and hence can lead to the death. Asphyxia is mostly seen in the strains that are involved over here are the gravis and the intermediates, and sometimes this can also lead to or cause acute circulatory failure, where there is failure of the circulatory system due to the presence of the toxins in the blood. Next is this can be followed by the post-diphtheroid paralysis. You can see the palatine paralysis mostly seen in the particular disease, and can be septic, involving the pneumonia or the otitis media, and the diphtheria disease is because of the production of the toxin, and hence it is called as a toxemia. So the organism multiplies and produces the toxin, and it is the toxin that shows the characteristic pathological features. So it is called as toxemia. And because of the production of the toxin, it can lead to local necrotic changes resulting in fibrinous exudates. And because of this toxin effect, there is vast dissemination of the epithelial cell, leukocytes, bacteria, etc. Together they form a membrane which is called as a pseudo membrane that looks like a tough leather. And because of this toxin necrotic changes, the tough leather is usually formed. And the mechanical complication is because of the membrane, whereas the generalized complications are associated with the toxin that is present in the blood. So that is called as the toxemia. And the systemic effect is because of the toxin, and mechanical effect is because of the pseudomembrane that is formed. And in non-toxinogenic individual, they have the ability to get affected with extrafacial infections, and this can cause infection even in the immunized individual. It is because the antitoxin is to protect from the toxin effect that is usually released by the organism, but not towards the bacteria. And non-toxinogenic strains are the one that usually causes the infection because of their multiplication and not because of the toxin. And hence this non-toxinogenic strains can cause infection even in the non-immunized or even in the immunized individual, because the toxin is towards the antitoxin. The antitoxin is towards the toxin but not towards the microorganisms. Coming to the lab diagnosis, how can we identify this organism in the lab? As already discussed, this organism is a disease of the child or a pediatric disease and can be very fatal if not treated properly. So lab diagnosis is very essential to initiate the treatment, and moreover initiating the treatment is not very important over here. It is to control the organism. Once it has been established that the person is suffering from the disease, we have to prevent the spread of the disease. So hence the lab diagnosis is to control the disease to spread and for the epidemiological purpose rather than treating the patient. And the treatment have to be started immediately on suspicion. Any delay can be fatal to the patient. And the demonstration of this organism can be done in the laboratory by isolating the organism and demonstration of the toxicity. So we should know whether it is a non-toxinogenic strain or a toxinogenic strain. So we have to grow this organism in the lab to identify the organisms and as well as the toxinogenic effect of this organism. So first we can go with the clinical specimen, that is a swab that can be collected. 1 or 2 swabs can be collected with the tongue depressed, and they have to be immediately transported onto the culture media. Demonstration of the organism is not very important in the spheres, because most of these organisms or the genuses related to these organisms are the normal flora of the human oral or the mouth. So it is difficult for us to establish whether this organism is involved in the infection or not. So we have to go further with the lab diagnosis of culturing the organism and identifying the pathogenic effect with the toxinogenic strains. So but this swab collection to identify the smears helps in distinguishing between 2 important groups. One is the diphtheria, the other one is the Vincent angina organism that are usually causing the similar type of infection similar to that of the diphtheria in the mouse. So in order to distinguish whether it is a diphtheria infection or a Vincent angina infection, you can go with the smears, but that cannot be taken as a presumptive test to identify the growth or the organism. So you have to go ahead with the lab cultures, where you have to isolate the organism in the lab in a pure culture and go with the toxinogenic effect of this organism. So the toxinogenic bacteria can be identified with a sophisticated technique which is called as immunofluorescence, and they can be identified on a culture media by making use of 2 important media, that is a low-flow serum slope or a telluride blood agar. As already discussed, this organism easily or rapidly grow on the low-flow serum slope, and identifying the cultural characteristic helps to identify the organism. As soon as we know that the person is suffering from the disease, immediately the treatment should be started without waiting till the last step of the lab diagnosis. And the selective media for the growth of this organism is a telluride blood agar, where the organism can be very well identified on a media as a black or a greyish colonies. And apart from these 2, you can grow the organism on an ordinary blood agar that is used to distinguish between streptococcal and the staphylococcal infection that can enhance the diphtheria infection. And if there is a delay in inoculating the swab onto the media, then you have to store the swab on a sterile serum and slow for nearly 4 to 8 hours. That is, it will prevent the organism getting contaminated with the other organism. Otherwise, you have to immediately transport it to the media. Next is, once the organism has been identified in the laboratory on a culture media or a selective media, the test cannot be stopped over there. You have to go further to know whether the organism is toxinogenic or not. So the further test that is carried out is called as the virulence test, that can be carried out either in vitro or in vivo test. In vivo, it is the toxin is usually the organism which is toxinogenic in nature, that is the strain that is involved in the disease causation is emulsified with the biles, and then they are inoculated onto the organism, that is the experimental animals, that is the 2 guinea pigs are taken as the experimental animal. So here 0.8 ml of the emulsified culture is introduced subcutaneously in both the guinea pigs. So one acting as a control, which has to be previously immunized with 500 units of antitoxin, whereas the other will be a test animal which will show whether the strain is a toxinogenic or not. After 4 to 8 hours, it will show the death of the guinea pig, that indicates the presence of a toxinogenic strain. But there is a wastage of animals over here, so we can shift to another more sophisticated type of in vitro test. Apart from the subcutaneous test, you can also go with the intracutaneous test, where here the similar test is carried out, but the experimental animal is the control is previously immunized with 500 units, and the test after inoculating with 0.1 ml of the virulent strain that has been emulsified, after 4 days that test animal will be given 50 units of the antitoxin to prevent the death of the organism. Now, how do we identify whether it is toxinogenic or not? So there will be an inflammatory reaction that can be seen at the point of injection, that helps us to identify whether the strain was toxinogenic or not. And with this particular test, we are not killing the animals, and moreover, more than 10 strains can be tested on a single experimental animal. Apart from that, the most sophisticated technique is the in vitro test, where we can make use of precipitation test or a tissue culture test. In the precipitation test, it is called as the Elix gels precipitation, where a rectangular sheet of filter paper is usually impregnated with the antitoxin of about 1000 units, and then it is laid over the horse serum agar that is still in a liquefied medium. Let it solidify, so the paper get adsorbed onto the surface, and after solidification you can go with the streak of the organism at right angle to the strip. So along with the test animal, you can go with the positive control streak and a negative control streak, and keep it for incubation. Now, during the incubation process, the organism, if it is toxinogenic in nature, will release the toxin into the medium, which will go and combine with the anti-toxin that has been impregnated with the onto the filter paper disc, and they form an arrowhead precipitation band, which helps us to identify whether the organism is a toxinogenic organism or not. So this is very useful for us to identify the toxinogenic strain in vitro condition. Apart from that, you can go with the tissue culture techniques, where mono layers of the cells we can go with the layering. Strains are usually inoculated onto the plate having the mono layers of the cells. Now, if the organism is toxinogenic in nature, it releases the strain, the toxin, and can kill the tissue cell that are present in the tissue culture. So the lysis of the cell indicates the positive reaction. Coming to the epidemiology of this disease, it is mostly a pediatric disease that is usually caused in the childhood, or the children's disease, you can say. And due to the effective prophylaxis and active immunization, we are able to completely eradicate this particular disease. But still, in the developing countries, this disease is rare, and in some of the countries, this is mostly seen to be fatal to the children. And most of the endemic diseases are caused by the mites, and they are the childhood diseases. And the children are usually protected from this disease immediately after the birth. That is, till 1 year they are prevented due to the passive immunization, that is the antibodies that they get from the mother. But this disease can be of risk after 2 to 5 years. That is, between 2 to 5 years you can see the children suffering from this disease, and the disease can be brought down after 5 to 10 years and completely can be eliminated after 10 years due to the active immunity that can be developed in the individuals. And it is asymptomatic carriers that can carry the infections. They carry the organism in the nasopharynx or the mouth or the throat, and in the temperate regions it is the asymptomatic carriers can carry in the nose or the nasal passages, and in the tropics it is mostly a disease of the skin and the respiratory tract rather than the mouth infections. And the toxinogenic bacteria can survive in the skin for a longer period of time and mostly involved in the natural immunity, but they cannot provide immunity towards the different strains, and they are mostly involved in the extrafacial infections. Fomites are thought to be less important in the transmission of the disease, but these diseases can be transmitted to the children if contaminated with the toys or the pencils. And this disease is mostly a human disease, but sometimes can cause infection in the cows where the udders are usually infected. Now, when the person consumes the milk from the infected udder's milk, then the person will be landing up to this particular disease. Coming to the prophylaxis, that is the control of the disease, it is mostly to the immunization, and it was Emil von Behring who came up with the production of the antitoxin to prevent from the toxinogenic organism and causing the disease. So this can be brought about by 3 ways. One is the active immunity, passive immunity, and combined immunity. In the active immunity, immunization is done with the help of antitoxins that are called as toxides that are prepared in the in vitro and provide a herd immunity and helps in the eradication of the disease. Whereas passive and combined protection is mostly given in emergency conditions when the person's immune system is completely lost or when it is immunocompromised. In that case, you can go with the passive or the combined immunity. Initially, because there were very less strains that were used to produce the antitoxin, and moreover more risk was involved, so the testing was done on a particular phenomena which is called as a Schick test. But now, because they are produced more safely and more toxinogenic strains are used to form the toxin which are converted to the toxide, no longer the Schick test can be carried out. So directly you can go with the immunization of the children. And the test, in order to know whether the toxin is working or the antitoxin is usually providing from the infection, you can go with the passive hemagglutination or the neutralization test. And it is said that the antitoxin level at about 0.01 unit per ml of the blood is provides the immunity to the individual. Coming to the active immunization, as I told you, this can be brought about by active, passive and combined. Active immunization was first described by Emil von Behring, who was able to produce a antitoxin mixture which when introduced in the individual protected the individual from the disease. But because there is some complication associated with that, the antitoxin mixture is not given directly, because the antitoxin might neutralize the toxin and cannot be immunogenic in the individual. So nowadays what they did was they had given the antitoxin mixture in parts, the toxin being given in parts at a time interval of 30 minutes. So this particular phenomena is called as a Danish phenomena. And when the toxin was given in parts, it was thought to be more immunogenic in nature, toxic and immunogenic in nature. And you can go with the other form of converting the toxin into toxide. 2 types of toxides are usually produced. One is called as a formalin toxide and the other one is called as a adsorbed toxide. So formal toxide is also called as a fluid toxide, where the toxin can be converted by incubating with the toxin of 0.2 to 0.4 ml or percent at a pH of about 3 to 4, and for 3 to 4 weeks the toxin can be converted to the toxide. So this can be given to immunize an individual. Apart from that, you can go with the adsorbed toxide where the toxin are usually adsorbed onto the insoluble aluminum compound. So we are not using of any hydroxide over here, but insoluble ammonium compounds are mostly used to adsorb the toxin to convert it into the toxide. So there was some risk associated with the adsorbed toxide. So people shifted towards the formal toxide, but the risk that was associated was less in adsorbed toxide, whereas the formal toxide was less protective when compared to the adsorbed toxide, and hence nowadays we are completely using the adsorbed toxide to bring about the immunization, and this is mostly given intramuscularly and mostly given in a triple vaccine form, protecting against 3 different types of diseases, which is called as diphtheria, pertussis and tetanus. Nowadays we have a quadruple toxin along with the inactivated polio vaccine, and mostly given to the young children. They are highly immunogenic in young children, and they are given in a dose of 10 to 25 LF units, and the D, smaller d and the capital D indicates the low dose which is usually given to the adults, and the capital D is a complete dose that is given to the children, and the schedule is given in 3 doses with an interval of 4 to 6 weeks, and the 4th dose is given after a year, and a booster dose can be given upon the school entry. Active immunization, as we know, is usually brought about by the vaccine, whereas the passive immunization is the one that can be brought about by giving the antitoxins directly that have been grown in the horse anti-serum. So in the active immunization, we are using the organism or the toxin directly to convert it into toxide. But here in the case of passive immunization, we are giving the antibodies to protect the children from the disease, and mostly given in emergency situations where we cannot wait for the child to produce his own antibodies to combat with the disease. So in that case, the antibodies that have been already grown in a horse serum can be given to the individual who is suffering from the dreadful disease. So it is given as an emergency measure where the antitoxin or the is usually given at a units of 500 to 1000 units of antitoxin, which is called as the antitoxin ADS, and we should be very well aware whether the person is hypersensitive towards this serum or not, that is a serum sickness. So after knowing that, you can give this as a passive immunization. Coming to the combined immunization, it is giving the immunization brought apart with both active and passive. Adsorbed toxin is the one that is selected over here, is given in one arm, and ADS on the other arm, and the full followed by the full course of active immunization, that is 3 doses, and we have a 4th dose and we have a booster dose. And here we have a combined immunization with ADS, and combined immunization have to be followed. When the person is given ADS, he has to be given a combined immunization as well. And coming to the treatment aspect, this organism is highly sensitive towards different types of antibiotics and can be treated by antitoxic or antibiotic therapy. Antitoxic, as we have already discussed, we can go ahead with the different antitoxins that are produced either with the active immunization or a passive immunization, and that is mostly immediately given as soon as there is a suspicious involvement of the organism, and the dosage is around 20,000 to 1 lakh units, half dose, which is given intravenously. And the cutaneous infection, which is non-toxinogenic in nature, you can go with the antibiotic therapy, because the cutaneous non-toxinogenic organism cannot be treated with the antitoxins. So because of the presence of the organism, we have to eliminate the organisms over here. In that case, we can go with the antibiotics. Mostly these organisms are sensitive towards the beta-lactam antibiotics, that is a penicillin, or you can go with the erythromycin. Coming to the other group of organisms that are associated with the Corynebacterium diphtheriae and involved in the different diseases that sometimes can cause confusion in the diagnosis. The most prominent group of other organisms belonging to Corynebacterium are the Corynebacterium ulcerans. They are the one involved in the lesions, and so similar to the Graves types. They can be identified in a biochemical characteristic where they are able to liquefy the gelatin and ferment trehalose slowly, and they can reduce the nitrate and nitrite. That is a distinguishing feature between the Corynebacterium ulcerans and the Corynebacterium diphtheriae. And the toxin that is produced is two type of toxins these organisms produce. One similar to that of Corynebacterium diphtheriae, and the other is similar to Corynebacterium pseudotuberculosis, which is the one that causes infection in the animals, and mostly infects the cows, and hence if the person consumes the infected cow's milk can land up to the disease. And this organism is highly sensitive to erythromycin and can be eliminated with the help of erythromycin treatment. Apart from that, we have another group of organisms which are called as Arcanobacterium hemolyticum, mostly involved in pharyngitis and skin ulcers. And we have Corynebacterium jejcium. Cutaneous and blood infections are mostly associated with this organism, and this organism is multi-resistant towards different types of antibiotics. So in a life-threatening conditions due to this particular organism, you can go with the vancomycin. And the organism which is involved in the veterinary diseases is called as a pre-Snocard bacillus, also called as a pseudotuberculosis, which is seen in the sheep and also seen in the suppurative lymphadenitis in the horse. And we have another organism, Corynebacterium renale, causing infection in the cystitis and pyelonephritis in cattle, and Corynebacterium equi, isolated from the organism that is suffering from pneumonia in the foals. The Corynebacterium involved in the suppurative or the superficial skin infections, they are the one that are the causative agents of erythrasma, which is the inflammation of the stratum corneum, including the axilla and the groin. And the organism involved is Corynebacterium minustissimum, and it is lipophilic organism that can be very well grown at 20% fetal calf serum. And we have Corynebacterium tenuis, causative agent of the trichomycosis axillaris, and these are the organisms that can be identified with the pigmented nodules. And coming to another important group of organisms that resembles completely to the diphtheria are the diphtheroids. This organism shows a structural similarity with the Clostridium diphtheria, and hence they are called as the diphtheroids. They are the normal flora of the mouth or the skin or the human body, and they show typical characteristics similar to that of the Corynebacterium, and they stain uniformly, whereas Corynebacterium species stain irregularly because of the presence of the granules. Here this organism can be differentiated because they stain uniformly, and they have few or no metachromatic granules, and they are usually arranged in palisade but not like wheel air form. And they can be identified with the help of biochemical test and the virulence test because these organisms are non-virulent in nature, whereas Corynebacterium are highly virulent in nature. There is a species of this Corynebacterium pseudodiphtherium, which is the normal commensal of the throat and sometimes can cause an infection in the throat, and Corynebacterium xerosis involved in the inflammation of the conjunctival sac or the normal flora of the conjunctiva. And these two organisms can be identified by a specific test in the media which is called as a pyrazinamidase positive test. So this organism shows positive with the pyrazinamide test. And other coryneiform bacteria are Propionibacterium species, which are mostly involved in the formation or the causation of the acne. So the species that belongs to Propionibacterium, it is also a non-sporing anaerobe. They are Propionibacterium acnes, Propionibacterium granulosum, Propionibacterium avidum. So they are all the one that are the inhabitants of the normal flora of the human skin, and they are highly anaerobic in nature and aerotolerant. That is, they can survive in an environment with a very minute amount of oxygen, and they can be grown only on a lipid media because this organism are able to metabolize sebum and cause the infection. They can be very well grown on a media containing a lipid. And the organism that is mostly involved in the causation of the acne is Propionibacterium acne, that has the ability to metabolize the sebum and cause the infection. Usually sebum hinders the activity of the organism, does not allow the growth of the organism. But because this organism have the ability to metabolize the sebum, it is able to cause the infection by clogging the pores and hence causing the acne. And we have Corynebacterium parvum, which is an immunomodulator organism, and this is all about the Corynebacterium species or the genus that is mostly involved in the different diseases, the most prominent being the diphtheria caused by Corynebacterium diphtheria.